There are a few constructs in Elka Med that make it very configurable. These include document templates, forms or form definitions, and form templates. Understanding these constructs will allow you to configure Elka Med to the needs of your specialty. A template can be used in two primary ways. On its own, a template is simply used to create documents. For example, a letter template. Using a letter template against a patient to create a document will result in a document relating to that patient, but using the template as a starting point for the document. Templates are stored in HTML format, as this universal format allows documents to be rendered in any browser. The second place the templates are used within Elka Med is when they are used in tandem with a form. These will be discussed while forms are explained. A form in Elka Med, or in most software, is an entity used to capture information, very much like a paper form would be. The advantage of a digital form is that data can later be used for various things. Forms that are captured to paper or to free-flow digital documents can lose a lot of the value that the data may bring. A digital form with a system that captures the data in a structured way is far more useful since structured data can be computationally analyzed and actioned. Forms in Elka Med can be used to capture any data, but there are two very common scenarios. Forms that are intended to be filled in by a patient are referred to as external forms since these can be filled in online away from the practice. The second type of form, or internal form, are those intended to be filled in by the clinician or practice manager. An example of an external form would be a shoulder questionnaire for a patient to complete in advance of visiting a shoulder specialist. An example of an internal form would be an operation form filled in by a clinician, capturing things like procedure codes, diagnosis codes, details about an operation, and people who were involved in performing an operation. Since forms in Elka Med are filled in through a web application, they can be sent out to patients in advance of a consultation or operation. This allows a patient to fill in the form at their leisure well in advance of the consult. This is beneficial for a number of reasons. There may be information required in the form that the patient does not know offhand, and in this case they can get hold of the required information to fill in. When filling out a form in a practice waiting rooms, this is often too late for the patient to be able to get that information. Secondly, the clinician has the information about the patient well in advance of the consultation. This can allow the clinician to be more informed in advance of the consultation, and this generally results in better decisions and safer medicine. Thirdly, consults can be shortened. Fourthly, the forms result in structured data. Over time, as more data accumulates, it can be used to gain insights about patient conditions, clinical treatments, and resultant outcomes. This again should lead to practicing better and safer medicine. Other computational opportunities such as business intelligence, artificial intelligence, and machine learning can arise depending on the nature of the captured data. Finally, where the captured data is relevant to registries such as orthopedic joint registries, Elka Med provides application programming interfaces, or APIs, that can be accessed to programmatically or manually populate these registries. For the clinician, internal forms can also be used to capture critical information, operation information, patient outcomes, and various other forms of data. Again, the data captured through these forms can be used for better insights and improved clinical practices. In comparison to free-form note-keeping, filling in forms is generally much faster, where the same information can be captured in a structured way without all the ancillary text and grammar that is required for free-form notes. When forms and templates come together, document generation is possible. This is extremely valuable in the time saving that results. A form can have a document template assigned to it. This type of template differs to a standalone template in that it contains patient and form variables or placeholders. What this means is that when a form is filled in, then the data captured is also used to generate a document populated with this data. An example of this might be an operation booking form. In this case, when a clinician decides, based on things like what type of operation is required, what procedures will be used, the related diagnoses, and what materials will be used, and when filling this into a form, the data generates a structured operation document. In many specialties, structured documents are used and required for various things. An example might be an operation document that a hospital requires. Without a form builder and a document generator, these documents would have to be manually populated for every relevant operation or event. This can save a huge amount of time for both the clinician and the practice manager, as well as minimizing errors. Errors in medicine can be tragic for patients and their families, as well as also being very sad and disappointing for a clinician. Mistakes can also result in medical legal nightmares. Technology should be used wherever possible to help minimize mistakes. Elka Med has been designed with this very much in mind and hopes to help clinicians, practice managers, and patients.